living longer, living healthier, living better than ever before. Welcome to Mountain Pacific's Healthy Living for Life, a weekly series that gives you the information, education, and expert insight you need to become an active participant in today's ever-changing healthcare climate. Here now is today's program host.
Urinary tract infections are the second most common infection in America and responsible for more than 8 million doctor visits every year. Who's at risk and how can you prevent a urinary tract infection? Welcome to Healthy Living for Life, a show dedicated to helping you do just that. I'm Jacob Churchill, and today we're talking about urinary tract infections. Stay tuned. Welcome back to Healthy Living for Life. Joining us today is Dr. Douglas Kunstweiler, Chief Medical Officer at Mountain Pacific Quality Health. Thanks for being here with us today, Dr. K.
It's a pleasure. Thank you for asking.
Of course. May I call you Dr. K? Or?
Absolutely.
All right, great. So let's jump in with our first question. What is a urinary tract infection, or a UTI?
Yeah, so urinary tract infection is a colonization by either bacteria or, in rare cases, yeast or fungi of the urinary system. That includes the kidneys, the ureters, the bladder, and the urethra.
Interesting. And who is at the greatest risk of getting a UTI?
Well, they're very common, as you mentioned in the opening. And actually, sexually active young women from about age 16 to 35 account for most of the cases. But there are other risk factors. People who have an altered immune system, people who have diabetes, people who have kidney stones, all of those are also at risk.
That's good to know. What is the difference between a urethra infection and a bladder infection? And I guess there's also a kidney infection that could...
Yeah, so that just depends on the anatomy. The way our body works, the kidneys filter waste products out of the blood and make urine. The urine travels down tubes that run from the kidney into the bladder. Those are called the ureters. And then the bladder stores the urine, and then it empties it out through a single tube, the urethra, which is the tube that passes the urine to the outside world.
And so those different infections are just different infections along that
right.
That tract.
Each infection has unique characteristics, but those are just anatomical sites that can be infected.
All right. What are some of the symptoms of urethra infection?
Well, urethral infections are not very common, and really the only ones that we worry about for the urethra are sexually transmitted diseases, primarily chlamydia and gonorrhea. Those are two types of bacterial infections. And the symptoms are usually pain when you empty your bladder and sometimes a discharge. But you also can have those and not have any symptoms at all.
Is a urethra infection as serious as a bladder or a kidney infection?
Well, that really depends. If you have an infection with gonorrhea in the urethra, it can spread into the bloodstream and it can go to other areas of the body. It particularly likes the joints and it can cause destruction and damage there. Chlamydia often presents without symptoms, and it can travel to a female's tubes and cause troubles with fertility. So it depends. They can be significantly.
Okay. What are some of the symptoms of a bladder infection?
So with a bladder infection, usually the things we see are pain when you empty the bladder, having to go frequently, having to go urgently. Sometimes people can have bladder infections and not have any symptoms at all. Particularly, for instance, in infants or toddlers, all you really will see are fevers or maybe nausea and vomiting. And sometimes in the elderly, they don't really complain of the usual, pain when they empty their bladder, but they might present with confusion or fever or pretty subtle symptoms.
And what about kidney infections? What are some of the symptoms of that?
Yeah, so the kidneys sit kind of up high under our diaphragm in the back of our body, and a kidney infection usually presents with pain in that area. So people have pain up in their back, and you are a lot more likely to have fever and to be significantly ill, nausea, vomiting, tenderness in your back, those kinds of symptoms.
And it sounds like those are some of the reasons why a kidney infection might be more serious than a bladder infection. But are there any other reasons why kidney infections are so serious?
Yeah. the infections in the kidney often damage the kidney, and of course kidneys have an essential role in keeping us healthy. And so if you damage the kidney, that can lead to significant problems.
Okay. Which, if any, of these different types of UTIs will go away without treatment?
Well, bladder infections will often clear themselves. It's estimated about 30 to 40% of bladder infections your body is able to fend off by flushing the bacteria out, and then also your body's natural immune response can oftentimes take care of that. Kidney infections, probably not so much. Those usually need help to get you over those.
What kind of treatment might someone expect if they were to have a kidney infection?
Kidney infection is primarily antibiotics. If the infection is not too well established, it can be antibiotics by mouth. If, however, you've got a more significant infection of the kidney, that usually requires IV antibiotics and probably some hospitalization.
That's good to know, something to watch out for. If someone thinks they have a urinary tract infection, when should they seek medical care for that condition?
Early.
Early, sooner the better.
Yeah. It might clear itself after a day or so, but if you have significant symptoms, you're better off going to see your primary care provider early rather than waiting and letting things get worse.
Now, what about is a UTI ever considered a life-threatening situation?
Well, certainly kidney infections can be life-threatening. Generally not if it's confined to the bladder, but the problem with that is that a bladder infection can ascend, and that is go up the ureter and affect the kidney. So that's another reason to get to your physician early and get it treated.
That's good to know. Well, thank you very much, Dr. Kunstweiler. We appreciate you joining us for this first segment. We need to take a brief break, but coming up next, we will discuss why some people are at a greater risk of getting UTIs and what types of treatment are available for those types of infections. Please don't go away. We'll be right back. Welcome back to Healthy Living for Life. Still with us is Dr. Kunstweiler, Dr. K from Mountain Pacific Quality Health, as we continue to learn about urinary infections. So jumping right back into it, Dr. K, we know that women are more prone to urinary tract infections, but do we know why that is?
Yeah, it has to do with the anatomy more than anything else. The female urethra is not very long. It's a short distance from the bladder to the outside. In the male, of course, the urethra is considerably longer. And in order to establish a bladder infection, the bacteria have to get from the skin surface up into the bladder, and it's just a shorter trip in the female.
All right. What about older men? I understand they are at a greater risk of urinary tract infections than younger men. Is that true?
Yeah, and that's a little bit different mechanism there. The prostate is a gland about the size of a walnut that sits at the base of the bladder, and it wraps around the urethra. In older men, it tends to get larger, and it can obstruct the flow of urine from the bladder through the urethra. And anytime you have urine just sitting in the bladder, not being flushed out frequently, then bacteria have a chance to grow and cause trouble.
That's good to know. Now, what about symptoms for UTIs? Are they always the same between men and women, or are there differences depending?
Well, they're pretty much the same. Usually pain when you're emptying the bladder, frequency, urgency that we talked about. With kidney infections, it's pretty much the same. That is pain in the back, fever, chills, that sort of thing. I think women probably have a little more trouble with incontinence, that is inability to hold their urine when they have an infection, than men do. And again, that just has to do with anatomy.
And I understand that catheters actually commonly cause urinary tract infections. When should someone who needs a catheter, what should someone who needs a catheter, know about urinary infections?
Well, urinary catheters are put in for a variety of reasons. If there's an obstruction to the flow of urine from the bladder, that's a reason to put a catheter in. Sometimes in people who are critically ill, we put a catheter in so that we can measure how much urine the kidneys are making, and that gives us an idea of how the kidneys are functioning. And there are other reasons why they're put in. Anytime you put a foreign body, like a catheter, into somebody, there's a chance for bacteria to colonize that foreign body. It introduces bacteria, and that happens every time you put a urinary catheter in. Now, that doesn't necessarily mean that those bacteria are going to cause trouble, but that's a potential for that. So if your physician tells you that you need a catheter, what the questions that you should be considering are, why do I need the catheter? How long do you anticipate that it's going to be in, and how will we monitor it and make sure that it doesn't cause problems?
That's excellent information. Thank you for that. I understand menopause can actually increase a woman's risk of getting a UTI. Why is that?
Well, there are a couple of factors. Everybody has a coating of bacteria on their skin all the time. We don't like to think about that, but it's there, and we live happily with most of those bacteria. When you go through menopause, the normal bacteria that are present in the vagina and the area around the urethra, that gets altered because hormone levels change, and that affects the bacteria. And so you lose some of the protective good bacteria when you go through menopause. The other thing that often happens is that there's more dryness. The vagina normally produces moisture and mucus, and that keeps it healthy. But when you go through menopause, there tends to be less of that, and so it gets drier. And when that happens, again, the good bacteria have a harder time thriving, and that gives an opportunity for bad bacteria then to establish and cause trouble.
All right. Still focusing on women, I learned recently that there are some forms of birth control that can make UTIs more common. Could you tell us a little more about that?
Yeah, the barrier forms like diaphragms and sponges, they tend to be bacterial traps, and using those can raise the risk of a bladder infection. Now, the oral contraceptives, the pill, they don't do that. Condoms don't do that. Spermicide, which is usually a sort of a foam that women can apply to kill sperm, also kill the good bacteria that we were talking about. And so spermicides and barrier methods like the diaphragm make it more likely to get a bladder infection.
And what about medical conditions that could potentially increase the risk of getting a urinary tract infection? What are some of those?
Yeah, we mentioned some of them in the beginning. Diabetes is a real common one. If your diabetes is not well controlled, you're going to have a greater sugar content in your urine. Bacteria love sugar, just like humans do, and so that helps them thrive. So diabetes is a real common risk factor. If you have kidney stones, bacteria can hide inside those stones and grow and proliferate. So a history of kidney stones can raise your risk. Other diseases that alter your immune system, things like rheumatoid arthritis, lupus, they lower your body's ability to fight infections, and so that's a risk factor. And then anybody who's had trauma to the urinary system, you can have scarring that can inhibit the normal flow of urine. And as we talked about, if the urine isn't able to pass freely out of the bladder, that raises your risk of infection.
Okay, and we talked a little bit in the first segment about different treatments for urinary tract infections. Do those treatment options ever change for people who frequently get UTIs?
Yeah, they do. If you have recurrent urinary tract infections, a common practice is to put people on a low dose but daily prophylactic dose of antibiotic to try and prevent the bacteria from building up in the first place. So that's a fairly common strategy. Another thing that people will often do once you've had recurrences, if they always present pretty much in the same way, your provider might give you a prescription for a limited supply of antibiotics that you can take on your own if you have the typical symptoms of an infection.
All right, well, that has been some great information. Thank you so much, Dr. Kunzweiler. We need to pause for another break, but when we come back, we will talk about how we can prevent UTIs from occurring in the first place. Stay with us. Welcome back to Healthy Living for Life. Still with us is Dr. Douglas Kunzweiler, Chief Medical Officer at Mountain Pacific Quality Health. And this segment, we're going to be talking about UTI prevention. So let's get right into it. We all know that drinking water and staying hydrated is really good for you, but how can that help prevent a UTI from occurring?
Well, as we talked about, the bacteria like to get into the bladder and live there. And if you are drinking fluids in adequate amounts, you will be constantly flushing them out, and so they just don't have time to get established and cause trouble. So that's how hydration works. It probably also helps our immune system. The more fluids you drink, the better blood supply you have, and it probably helps in that way as well.
Oh, I wouldn't have thought about that, the blood supply. That's really interesting. Many of us have probably heard about a home cure for UTIs being cranberry juice. Is there any science to back up that remedy?
The science is there, but it doesn't support the use of cranberry juice. The idea is that cranberry juice is fairly acidic, and most bacteria don't grow well in an acid environment. So the thinking was if you drink a lot of cranberry juice, that will inhibit the bacteria. And it probably does, but not to a significant extent. And so that really isn't much of a cure.
That's really good to know, dispelling some of those old wives' tales. Yeah. I like that. And we touched on this a little bit last segment, talking about different types of prophylactics, but what can sexually active adults do to further reduce their risk of UTIs?
Well, staying hydrated is probably the primary thing. We do often instruct women to empty their bladder soon after intercourse, and that's because during intercourse, the bacteria are sort of getting massaged up into the bladder, and so that probably helps. Drink a glass of water and then empty your bladder, within an hour or so after intercourse. We think that's helpful. Of course, to prevent the urethritis we talked about, that is the infection of the urethra, gonorrhea, chlamydia, a condom is really the best method to protect yourself from those.
Okay. Can wearing certain types of clothing help prevent UTIs?
Well, it's recommended that you wear natural fibers like cotton and wool because they breathe better. I'm not sure that really helps much with prevention, but it is certainly true that if you wear fabrics that don't breathe well, that might raise your risk a little bit of an infection.
And is it true that alcohol and caffeinated drinks can increase the risk of a urinary infection?
There might be a little bit of an increased risk. I don't think that's really particularly high. Both of those have a weak diuretic effect. That is, they make your body lose fluid, and so through that mechanism, they might raise your risk a little bit, but I don't think that's really prominent.
Okay. What about any other foods or drinks that should be avoided if someone is concerned about urinary infection?
Yeah, it's sort of like the cranberry juice thing. I'm not aware of any foods that will make you particularly prone to urinary tract infections. If you have a history of kidney stones, we recommend a low protein diet because that helps to reduce the formation of kidney stones. So that can be a factor. But otherwise, I think a healthy diet is best, and I wouldn't worry too much about it raising your risk of bladder infections.
Is there anything else that you could think of that maybe we should be avoiding to reduce our risk of UTIs?
Well, I think the things we've talked about, if you're a diabetic, make sure that you have your diabetes under control. Talk to your primary care provider about that. And in general, just staying healthy, staying hydrated, eating a healthy diet, getting exercise. All those things aid your body's immune system, and that's probably the best thing you can do to prevent infection.
Well, do you have any other advice on how to avoid urinary infections? I feel like we've covered quite a bit of ground already.
Yeah, actually I do.
Yes, please.
One is to empty your bladder often. You should be emptying your bladder every 2 to 3 hours. People get busy and, you can hold your urine, but that's really not very healthy. It's better to be emptying every couple of hours. So I'd recommend doing that. And then, as we talked about, if you have symptoms, get them checked out early. Don't wait and cross your fingers and hope things are going to get better. See your primary care provider.
All right. Well, we are about out of time. Is there anything else you'd like to share with us? Make sure we hear before we finish up the program today.
Yeah, get vaccinated, keep well hydrated, eat healthy, and walk.
All right, that's excellent advice. Thank you so much for coming on the show with us, Dr. Kunstweiler. We really appreciate it.
You're welcome. Glad
that
to be
is
here.
Unfortunately all the time we have for today, and thank you very much for watching. We hope you'll come back next week and join us. Until then, stay fit, stay well, and stay healthy for life with Healthy Living for Life.
Healthy Living for Life is brought to you by Mountain Pacific Quality Health. We'd love to hear from you. If you have suggestions for future programs, visit our website at mpqhf.org or call us at 406-443-4020. You can also catch us on YouTube by visiting our website and clicking on the Healthy Living for Life logo. Production facilities provided by Video Express Productions.